Welcome back to the Humble Healer podcast, and thank you for tuning in. This is Dr. Kwang Lei, family medicine physician, and today I have a special session. And my sister-in-law Rhonda, she has very graciously agreed to join the podcast to talk about topics that I talked about last week about menopause. And I think that it's important to bring a patient perspective in terms of what they are going through to help both men and women understand what this process is. I remember talking about bringing up menopause on my podcast, and one of the male friends I have is like, "Oh no, I'm not. I'm not listening." I say, "No, you should listen. That way, you can support your spouses and see what they're going through, and you can understand better. And if they um, need some space and you can understand maybe there's a reason." So I think that is good information for both men and women. So please listen in, and we'll get the experience that Rhonda is going through, and hopefully she will teach us and show us what menopause is all about, and so we can understand better and can support the people that are going through that process better. So to start, Rhonda, please tell us, how did you know that you started having premenopausal symptoms, and how long did that process last before you actually hit full menopause, if you actually knew when full menopause started?
Well, that was kind of the complication with me because I'm now 52. Around 48, I started having some heavy bleeding in irregular periods. So, of course, I went to my doctor and she said, obviously we got to do something about it. We got to watch your levels of your H and make sure everything is staying where it should be because it could get to the point where we got to do something. And it did. So my doctor suggested I have the ablation of my uterus, which I did. So I was 49 when that happened. And for me, that worked wonderfully. Once the procedure was done, I immediately stopped bleeding. However, she advised me that this didn't mean menopause. It just meant the bleeding stopped. I would still probably get the effects of my period that I got before. Any kind of PMS that I had before, I would get that. If I had breast tenderness, cramping before, I would probably still get that. I just wouldn't have the bleeding. Um,
Just to
and
clarify real quick too, I'm sorry, that when Rhonda mentioned H&H mean that it's a red blood cell count that happens when, a woman has bleeding. Sometimes a doctor checks to make sure that she didn't lose a lot of blood. And also, a lot of time the bleeding comes from benign polyp or fibroids from a woman's uterus. So that's when Rhonda went through the ablation, which is a procedure where they came in and they either ablated or cauterize it so that it stopped bleeding, or sometimes even remove the whole polyp or fibroids. So that's to clarify for the medical term for the audience. Thank you, Rhonda.
okay, so again, that worked great. I went on no bleeding for 2, 3 years till about 6 months ago. I was fine, kind of out of sight, out of mind, not thinking of anything because I was kind of at the age when I had the ablation, but obviously I wasn't in menopause yet because I was bleeding. So around 6 months ago, I started having possible night sweats. I wasn't sure what they were, but it was in the middle of summer when this started. So again, back in June, I'm a very active person. Wasn't kind of just again out of sight, out of mind. Was thinking, all right, till the point where they started waking me up at night, and they started like really just a full out sweat, even when I was just sitting, not exerting myself at all. So it kind of got me thinking of, geez, I know what is this and what's going on. Of course, I talked to my dear brother-in-law and he said that, oh, well, you're at that age. And it just honestly I didn't think about it. And I said, all right, well, it wasn't that bad. It was affecting my sleeping habits to a point, but not super bad yet. But then as the weeks went on and the months went on, I started getting all little different things. Like all of a sudden I'd have headaches. Then recently in the last month, I started getting joint aches to the point where like that would wake me up. I felt like when I got out of bed, I felt like an 80-year-old woman. Like I couldn't bend my knees. I was constantly in pain, either my hips, my knees, even sometimes my elbows, not realizing again that that was a sign of menopause. I think that's a lot of the problem is there's just so many different things that are attributed to menopause. We just in our head think, oh, when you stop bleeding for a year. And of course, we couldn't count that on me because I had stopped bleeding years before. So I went to my dear brother-in-law again, and we did some research together, and he suggested that it was uh, a safe solution in my medical history that we could try a low dose estrogen. And we have tried it. I've done it for 3 weeks now. It's a low dose estrogen patch that you put on once a week. And I will tell you, I don't know if it's all in my head or not, but I feel great. The night sweats have definitely gone away. My joints are feeling much better. That's slowly getting better. Um, and the headaches have completely gone away. And I'm feeling great. So I don't feel any side effects as far as the estrogen goes. I just feel better. And I'm attributing this massive turnaround to that.
That's amazing, Rhonda. Glad you're feeling better. Do you remember that you got a blood test? They call the LH and FSH checked to confirm that you were indeed in menopause. Do you remember?
Did
Yeah.
Yes, I did get those. I did get those done from my primary care. My OB couldn't see me, and I happened to be at the primary care anyway. So I asked him if I could get that done so she could have it when I went to confer with her about all this stuff. And when I did get them done, I was definitely, in fact, in menopause. I had like no estrogen, and all the reference ranges pointed to the fact that I was over the premenopause and I was officially in menopause with very low estrogen levels.
That's good to hear. And just to remind the audience from the previous episode that we had to make sure that, patients like Rhonda are safe to take the medicine too. If you are a chronic smoker, then that increases the risk of having a blood clot when you take the hormone. So you wouldn't be a candidate, unfortunately. If you have history of, endometrial cancer or, uterine cancer, or even breast cancer, then you probably wouldn't be a candidate. Or you have history of blood clot in the past in your lungs or in your legs, then you're also not a candidate either. So it is important that we make sure that it's safe for our patient to start the medications. But once it's determined that it's safe to take the medicine, it can do wonders in helping improving symptoms of a lot of patients that are going through this. What so you the premenopausal period for you, did it sound like it lasted about a few months or so before you think you hit full menopause?
Yeah, I would say, like I said, I didn't think too much of it at first because it just started with like everything progressed. So the night sweats were like, one every other day or, once a day, twice a day, to the point then as the weeks went on and then the months went on, probably 6 months, 7 months, then at that point it was every night, all the time, and the unfortunate thing with them is they're out of nowhere. So, you could be sitting in the middle of a meeting and all of a sudden you feel it coming on, and now you're really perspiring down your face, and it's such an uncomfortable feeling, especially when you're sitting there trying to pay attention to a speaker in a meeting. I work in the medical field. I'm working on instruments, looking at microscopes, and all of a sudden you just like want to rip your lab coat off. It's so hot. You can't. You're in a field where you need gloves, you need coats and stuff like that. So that part was very difficult. And it just kept getting worse. They kept getting longer, more frequent. I have a wonderful brother-in-law that didn't make me go through that torture for that long. But I will say to everyone out there, if I didn't have that, if I didn't talk to him, I know I have a great rapport with my OB, but she wasn't able to see me for another 3 months. Obviously, they're busy. And unfortunately, a lot of people, the symptoms are so all over the place. And like, if you just called and said, I have headaches all the time, yeah, okay, we'll see you in 6 months. Now you got to suffer with all that. But in the meantime, you're not sleeping, you're cranky, you're in pain with your joints. And it's just an all around uncomfortable feeling. So for me, again, I started the patch about 3 months ago. So it's been a short period of uncomfortableness. But I think the big thing is to not ignore it and talk to somebody about it because there are solutions out there. And mine, in my personal opinion, helped tremendously.
So another option is, I mean, I work in a super urgent care where we have, if you go to those centers, and I can guarantee that anyone there can help you, but certain, clinicians or doctors who are familiar with dealing with menopause, they may be able to help you by checking, your blood test and, make sure that you're safe to give the medication. And I would not hesitate to give patients like Rhonda who, suffering, going through this, you know, difficult transition, some medicine to provide some relief until she can go see her either primary care physician or her OB, physician or provider. So don't wait too long. Don't think that it's gonna last a few months because it can go on for years. It's really affects your quality of life, both mentally and physically. And also keep that in mind too that later in life there will be a condition called genital urinary syndrome of menopause, and I mentioned that in the previous episode where, due to changes in the reproductive part of the women's body, you start having more pain with intercourse, or you have also burning with urination, or also, you can have just frequent UTIs. So if you've been in menopause and you have those symptoms, make sure you get evaluated and treated. And I've seen a lot of female patients after menopause with frequent UTIs, and they just got bombarded with antibiotics. In courses of antibiotic for these UTIs, and they end up with C. diff colitis and all that other complication associated with taking these antibiotics all the time. Instead, you should look and see whether they have this syndrome called genital urinary syndrome of menopause (GUSM), and then the treatment could be a topical estrogen for those patients, and that can really help reduce the frequent UTIs, painful intercourse, or thinning of the vaginal lining and so on, and other uncomfortable symptoms. So that's something to be aware, and especially when you have those symptoms. Do you have any other last advice for the patients, in terms of before they have menopause and after, or when they're going through menopause, and also what their spouses can do to help them, Rhonda?
Well, I definitely think don't ignore it. It's so much of an old theory is, everybody goes through it. It's a fact of life. It's going to happen. But, nowadays medicine is so great and, we have so much more knowledge out there. Go talk to somebody. Don't hesitate. Don't wait. Don't sit there and suffer because you don't have to. Because there's different things like you were talking about that, and there's also different symptoms. So there's different things that can be done. Definitely talk about it with your spouse. Make them realize that this is something that's happening. I'm not crazy. I'm not crazy. I'm not cranky for a non-reason. Explain it to them. Let them know what's going on. We all laugh about it, and now there's a musical about it and everything. And it kind of is a joke, but it's not when you're going through it. Is the thing. And we're all going to be there, but there's no need to suffer for it. And just really go talk to someone about it as soon as you can. Don't wait.
And when you talk about educating your spouses,
Mhm.
just know that most guys don't know much about this menopause. They actually did an interview of older guys walking on the street, and they thought it was some sort of puberty or something. They had no idea that menopause is all about what causes it, how old you're supposed to be to have it, and so on. Talk to them like they are 6-year-olds, and tell them why you're going through this, and there's scientific reason for that, and why feeling hot and cold all the time, why you turn up and down the thermostat. I think that my father-in-law and your father is supportive. He covered himself with 5 blankets when your mother opened the window in the middle of the winter.
Absolutely. Absolutely. You gotta learn to live with each other. It's not a lie. It's really happening. And you're right. If your spouse understands what you're going through, then you can find a happy medium somehow. Whether it's 5 blankets and you walk around in a tank top in the middle of winter, whatever works. But it's real and it's happening. And yeah, you're right. Talk to them like they're six. Bring them from, menopause for dummies.
It's not a taboo subject. Remember, the more you talk about it, the more you understand and can support each other,
Exactly.
and that's what it's all about. And that goes for guys too. You have any problem with the prostate, educate your spouses so they understand what you're going through.
Absolutely.
So communication is everything. So that's the end of this episode. And thank you so much Rhonda, for educating the audience and myself about what you're going through. And please leave any feedback or anything that you have done or experience you've had with menopause and premenopause, and what you have done that have been helpful and what you have done that have not been helpful. Thank you so much, and take
Thank
care.
you. And one more point before I leave.
Sure.
If
Sure.
somebody doesn't listen, if you go to a clinician and they kind of blow you off, go to another one, because there's someone out there that will listen. Keep talking the squeaky wheel, or just go see my brother-in-law Kwang. He's awesome.
Talk to your friends and find out, who has helped your friends,
Yeah.
right? And your family members. And then maybe you
Absolutely.
can go see that person, but you deserve the help. You deserve that help, the sooner the better, because that's affect your quality of life. And any caring clinician would love to do that to help improve your life and help you feel better. So make them happy too.
100%.
Thank you, Rhonda. Have a wonderful rest of the day. Thank you
You
for
too.
tuning in. Take care,
All right.
everyone. Bye-bye.
Bye.